Hello, I'm Kayla Monfort, Co-Director of Activate Allen County. I'd like to welcome you this afternoon and thank you for taking some time out of your busy schedule to join us as we talk about a very important topic, the health of Allen County. Today, we will briefly touch base on a variety of successes and also future goals from our Community Health Improvement Plan. For those who do not know, the Community Health Improvement Plan is a way for our county to track progress within a wide variety of health initiatives and encompasses community data and the work of many organizations, groups, and stakeholders throughout the community. The plan is important because it shows the collective nature that we need to take when we approach community health. When we all work together down the same continuum of health, great things can happen. To get us started today, I would like to introduce Mr. Bob Cupp, Ohio's Speaker of the House.
I'm Bob Cupp, Ohio's new Speaker of the Ohio House of Representatives, and I'm pleased to join today's event and to welcome you to this 2020 Activate Allen County Community Stakeholder event. You know, much has happened since last year's event because of the COVID-19 pandemic. There probably has not before been in living memory such a broad public understanding of the need to stay healthy. The Lima-Allen County Chamber of Commerce is to be commended for continuing to hold the community stakeholder event in spite of the present health circumstances. It's evident that community health and the health of our citizens have never been more important. As of December 7th of this year, there has been nearly 500,000 total COVID cases in Ohio alone, and cumulatively, nearly 30,000 Ohioans hospitalized, and a total of 7,000 lives lost in the Buckeye State due to COVID-19. The virus has, of course, impacted lives in many related ways, too. These include increased depression and emotional distress among citizens, both young and old, a tragic correlation between increased unemployment rates and increased suicide rates, and increased drug overdoses, alcohol abuse, and domestic violence. There is no doubt that COVID-19 pandemic has had an enormous impact on our workplaces, schools, faith-based institutions, and throughout our society. And all of this is on top of the health conditions and chronic diseases that were present before, such as coronary heart disease, stroke, diabetes, cancer, COPD, and arthritis. To tackle healthcare and public health issues, it's important that all sectors of our community collaborate and plan together for ways to achieve a healthier and better future. That's government, businesses, nonprofits, and citizens who all play important public health roles. And Activate Allen County has a significant role in this effort. Local plans, like the Allen County Community Improvement Plan, help create the foundation that supports the state of Ohio's State Health Improvement Plan. And working together at a local level is an excellent way, and truth be told, probably the most effective way to ensure that Allen County residents have the opportunity to live healthy and productive lives. So, thank you for linking in today to learn more about plans for the health of Allen County.
Thank you very much, Mr. Cupp. Hello, I'm Josh Underbrink from Activate Allen County. Before we begin with our presentations, I want to encourage everyone who is watching live on Facebook to please ask any questions that you may have in the comment section and answer the survey questions that will be posted throughout the video for your chance to win Lima-Allen County Chamber of Commerce gift certificates. Now, I would like to introduce Tammy Colon from the Mental Health Recovery Services Board of Allen, Auglaize, and Hardin counties.
Thank you, Josh. I'm Tammy Colon from the Mental Health and Recovery Services Board of Allen, Auglaize, and Hardin counties. The Opioid Action Commission was established in late 2016. The purpose was to engage leaders in the oversight and promotion of a community-wide effort to tackle the opioid epidemic and suicide, as well as energize the community to embrace prevention. Why do we need to tackle those two social concerns simultaneously? Suicide is the leading cause of death among people with substance use disorders. Compared with the general population, people treated for alcohol abuse or dependence are at about 10 times greater risk for suicide, and those who inject drugs are at about 14 times greater risk for suicide. The goals of the Commission included withdrawal management centers here locally, which has been completed through St. Rita's Medical Center and the We Care Regional Crisis Center. Student and parent education has been completed through the Let's Talk campaign. We have several recovery homes in our community. Project Dawn has been implemented in our community through the Health Department and Coleman Professional Services. We have quick response teams of peers that are responding to emergency departments for overdoses. We are recruiting more physicians who are willing to assist us in this battle and provide medication-assisted treatment to individuals with addiction. We are monitoring prescription practices through the OR system. We have prevention in all of our schools. We're monitoring drug overdoses community-wide through the epicenter that we receive the information from the state of Ohio. Why do we need to re-energize the commission? Because drug overdose deaths did decline by 5.1% in 2018. However, the CDC is reporting that there will be more deaths in 2020 than previously recorded in 2017. Only 55% of those who need treatment for heroin use disorder and 21% of those who need treatment for prescription pain reliever use disorder get treatment. Suicide is the 10th leading cause of death in the United States. It is the second leading cause of death for ages 10 to 24. The Opioid Action Commission will be establishing new goals to help promote the health and well-being of our community. Currently, the following are areas that require intentional effort. We need to increase prevention and education among our youth with an intentional focus on our minority communities who are 2 times as likely to attempt to kill themselves. The rate of increase of Black African American drug overdose deaths is 25% compared to the overall population increase at 11%. We need to recruit and retain qualified behavioral health specialists and reduce secondary trauma stress on those who are currently providing care in our community. We must increase Narcan distribution in our community to save lives. And we have to get creative and develop additional harm reduction programming that works for the people in Allen County. And now I'm passing this off to Rhonda Lehman with Mercy Health.
Thank you, Tammy. Hello, my name is Rhonda Lehman, and I'm the president for Mercy Health St. Rita's. Chronic disease and obesity are both serious issues for us here. As I think about some of the ways that we've been able to work with other agencies, one of those is through the Activated School Challenge. The Activated School Challenge has been an opportunity for us to partner with area schools to create both initiatives and new programs that help kids get active from a very young age and learn about behaviors that are going to help improve their health for a lifetime. In addition to that, we've also been key supporters for the Go Noodle program. The Go Noodle program is an innovative opportunity for kids to have both mindfulness as well as some body movement, again, instilling on them that learning can be fun, can be movement-based, and helps create good patterns of behavior. In addition to those areas, we've also been able to work with agencies to create more walking paths, more bikeable areas. In addition to that, we've had community gardens. We're very proud of the farmers market each summer. So those are just a few of the ways that we've been able to contribute, but we also recognize that we couldn't have done those things alone, that being a part of Activate Allen County has really allowed so many of us to come together, not only to care for those who need us when they're sick, but also really to work on the preventive side of healthcare. And now I'd like to introduce Sharita Smith.
Thank you, Rhonda. I'm Sharita Smith from the City of Lima. In 2019, with the support of Lima City Council, we hired a consultant to provide an assessment of Lima's housing challenges. The assessment involved public input through surveys, interviews, working meetings, and an assessment of prior studies and current programs, and produced a 70-page report on housing in Lima, including opportunities, challenges, and a broad set of recommendations to meet those challenges. The report also reached some factual conclusions. Safe and decent housing is a priority for Lima citizens. Income isn't keeping up with housing costs. We have a problem with blight. And by 2030, we need an additional 1,175 homes. What the report did not provide was an implementation plan and consensus from the community around getting that work done and establishing agreed upon priorities around what to tackle first. The work of the Housing Task Force will be focused on building that consensus, establishing those priorities, and providing an implementation strategy that preserves and creates a range of housing options to meet the needs of Lima's homeless, low-income, middle-income, workforce, and market-driven housing demands for the next 10 years. Housing for all. We have to be competitive with other communities in terms of overall quality of life, and housing is a big part of that. We have to be honest about where we are, honest about what resources we have, and decide as a community how we are going to move forward together. One of the previous CHIP goals was to control the use of tobacco in our community. Nearly all smokers start as kids or young adults, and these age groups are heavily targeted by the tobacco industry. As of October 17, 2019, it is illegal to give, sell, or otherwise distribute cigarette, other tobacco products, or alternative nicotine products like e-cigarette, vaping products to any person under the age of 21. Increasing the tobacco age to 21 helps prevent young people from ever starting to smoke and to reduce the deaths, disease, and healthcare costs caused by tobacco use. And now I'd like to turn things over to Kathy Lung from the Allen County Public Health Department.
Hello, I'm Kathy Lung, Health Commissioner for Allen County Combined Health District, and I appreciate the opportunity to meet with you today. First, I want to address the elephant in the room. The very fact that we're coming together through this virtual event is evidence of this new reality as we all live through a pandemic. The COVID-19 pandemic has certainly brought new attention to public health and the health of our community. As your local public health agency, our mission is to protect and promote the health of Lima, Delphos, and all of Allen County. Living in a world where this new coronavirus exists brings together a unique blend of those two critical public health roles, protecting and promoting our health. Today's structure of public health in Ohio has its roots in the aftermath of the 1918 worldwide pandemic. Protecting our community from communicable disease was a focus of public health in the early 20th century. As infectious diseases were brought under control through such measures as antibiotics and vaccinations, the focus shifted to health promotion, and we emphasized education to encourage people to make healthy choices to combat what had become the new major killers: chronic diseases like heart disease, diabetes, and cancer. We encouraged people to quit smoking, choose healthy foods, and exercise more, with somewhat limited success. Something we've learned over the years is that individual health is so closely linked to our community and the health of the community in the environment in which we live, learn, work, and play. While we think about where we live, learn, work, and play, it's obvious that the pandemic has had a huge impact on all aspects of our individual health: social, emotional, economic, mental, and physical health, not to mention the overall health of our community. Sending school children home for distance learning has many unintended effects that impact safety, nutrition, and psychosocial development, just to name a few. Adults have had their work routines interrupted and jobs lost, and certainly our local businesses have been impacted. I tell people that the reason we have the word pandemic is because a pandemic is unique. They're huge, and they disrupt almost every segment of our society. Resiliency and recovery from the pandemic are critical aspects as we move forward. Another feature of a pandemic is that they highlight and exacerbate community conditions and issues that already existed. For example, the overall health of individuals in our community. Words like quarantine, isolation, and social distancing have become part of everyday conversation. Nationwide, there have been increases in suicides, increases in the number of people using drugs, more people reporting symptoms of depression and anxiety. This is certainly not the direction we were heading before. One aspect of health that has been part of the conversation around COVID-19 is the role that underlying health conditions play, as some conditions put people at greater risk for complications from the virus. We know from our community health assessments that Allen County residents have high rates of chronic disease such as obesity, high blood pressure, heart disease, cancer, and diabetes. We also know that certain segments of our population are more likely to have chronic health conditions. For example, our data tells us that people with lower incomes are more likely to have many of the high-risk health conditions for COVID-19. Race is another area where we see disparities. Existing social and economic conditions also play into this equation. What this means is that the pandemic impacts different segments of our population differently. Many of these health disparities are being magnified right now. During a pandemic, those at higher risk generally do not fare as well as those with optimum health. We are definitely seeing people who are Black being disproportionately affected by COVID-19 here in our community. Did you know that in Allen County, Blacks make up 12 to 13% of our population overall? Yet they represent 25% of Allen County residents who have been hospitalized due to COVID-19. Others at high risk include the homeless, the uninsured, and people with behavioral health issues. Nothing about this pandemic has been ideal. Our community has faced challenge after challenge, and it's not over yet. However, we can see success. We have strong partnerships in place in our community, and we've already acknowledged that no one organization can address the health issues and disparities we face. Public health is the prime responders for a pandemic, but we can't address all of these impacts of a pandemic by ourselves. With something of this magnitude, we have to rely on our partners. Our success is that our local businesses, agencies, and organizations have stepped up to do what they do best in serving our community. The pandemic has reinforced just how much we need the support of each other. A coordinated and collaborative response is the only way our community is weathering this COVID-19 storm, and it's the only way we'll continue to make progress toward our ultimate goals. While we are all busy responding to this pandemic, it's good to know that we haven't lost sight of our community goals. We are still working together to protect and promote the health of everyone in our community. 2020 has been a tough year. We've lost friends and loved ones. We've faced scary times and new challenges at every phase of this pandemic. And I know it's not over yet. As we approach the end of this year, we all look forward to the promise of 2021 and the years to come. We are going to get through this. We're going to get through this together. At this point, I'm happy to turn things over to Derek Steeman to share more about our vision for health equity, when everyone has an equal opportunity to achieve optimum health, whether it's our everyday health or a once-in-a-lifetime pandemic.
Thanks, Kathy. My name is Derek Steeman with United Way. So far, you've heard a little bit about where we've been and what we've been able to accomplish over the past 3 years. And now I have the distinct privilege of pointing us to the future by sharing about where we are going and what we hope to accomplish together as a community. You know, this year has been a year like no other. No matter who you are or what business or organization you represent, all of us have been challenged to find new and innovative ways to provide services to the community. And I think as a result of this process, it has exposed areas in all of our businesses, organizations, and even communities where we need to and can do better. One area that we see this to be especially true is around the area of health equity. You see, we believe that everyone should be given a fair opportunity to live a long and healthy life. But often many individuals in our community face barriers that hinder or prevent them from having this opportunity. And I don't want us to get health equity confused with equality. The main difference in these is that equality has the assumption that everyone will benefit from the same level of support or equal treatment, as you see in the diagram before you. But equity takes it a step further to get everyone the support they need to achieve success. And that is exactly what we want for our community: success, health, and a long life. We envision a community where all individuals and families achieve their human potential through living healthy lives. But here's the thing: we can't do it alone. There's a lot of groups currently fighting for equity in our community. But our goal is that through the Community Health Improvement Plan, we will bring together our community to work on health equity together, because we firmly believe that we are better together. We believe this because working together ensures that we aren't duplicating services, but instead it allows us to multiply the collective impact and power of our community. One of my favorite examples of collective impact can be seen in the story of the Belgian plow horse. If you've never seen a Belgian plow horse before, think of the huge Clydesdale horses. A single Belgian plow horse can pull 8,000 pounds. So it would stand to reason by pairing it together with another Belgian plow horse that collectively they would be able to pull 16,000 pounds. But here's what's interesting. When you put them together, they actually can pull 24,000 pounds together, each pulling more than they would be able to apart. But what's interesting is when you train them day after day for 3 months, eventually they're able to pull 32,000 pounds together. In other words, they're both able to double their output together. That's our hope for our community, that collectively we will achieve far more together than we ever could apart, that we will be truly better together. And now it's my privilege to turn it over to Jackie Fox with WOCAP to share a little bit about our housing initiatives in the upcoming Community Health Improvement Plan.
Thank you, Derek. Hi, my name is Jackie Fox, and I'm the Executive Director of West Ohio CAP and a current member of Activate Allen County's Executive Council. I'm here to talk to you today about one of our goals, which is increasing lead testing in Allen County. So why do we still have a lead problem in 2020? Well, lead paint chips and dust in homes built before 1978 are the most common ways that children are poisoned by lead, and dust being number one. All these other things that I have listed are also ways that folks can be poisoned. The problem is it's the law that children are tested in the state of Ohio, and it doesn't always happen. The lifelong harm of children that are poisoned by lead, as you can see here, is pretty significant. At lower levels, we have hyperactivity, hearing loss, and reduction in IQ, which is permanent, by the way. And at higher levels, it could even cause death. We see some of these effects of lead poisoning in young children with reduced verbal skills, increased reading disabilities, and in older children, struggles with cognitive and emotional delays and delay in gratification. These are things that we see in the public school systems and in child care programs. And you see it even affects teens and adults. Lead poisoning impacts children across the state of Ohio, and Allen County is number 12 in one of the 13 highest risk areas for children to get lead poisoning. Ohio's current downstream approach to lead is one of the problems, and it's like that all over the nation. We wait for children to become poisoned, and then ODH steps in and they do an inspection of a home, and if they find lead, they order the landlord or the homeowner to abate the lead, and they have 90 days to do it. Well, if it's too costly to abate the lead or someone doesn't want to abate the lead, then the home becomes vacant. I've had many landlords tell me that if it's too costly to abate the lead in the home, it's not worth it, and so they just evict the tenants and leave the home vacant. In Allen County, we have about 5 to 7 vacate orders from the Ohio Department of Health with homes just sitting empty. So testing in Ohio and Allen County is important, of course. So just looking at some of the numbers, you see here we have more than 689 children under the age of 5, and of that only 24% are tested, which is a little over 165,000. And then about that, we have about 3% of children that are positive. So that's 4,975 children in the state of Ohio. If we look at Allen County, our population for children under age of 5 is 6,243. If we apply those averages, we would get 1,490 children that are tested for lead. Not enough, that's about 24%. And of that, we would get 44 children that were positive. I did the math on that, and if all 6,243 children were tested, we would have 187 children that were positive for lead poisoning in Allen County. So that means there's a lot of children out there that are possibly poisoned and aren't getting any early intervention services. And that's why it's important for us to increase the lead testing in Allen County. I want to thank you for giving me an opportunity to speak. And next up is Rick Skilleter from PASS.
Thank you, Jackie. I'm Rick Skilleter with Prevention Awareness Support Services, also known as PASS. PASS works collaboratively with other community partners to address emerging needs centered around an individual's physical and mental well-being. To capture the elements of our Community Health Improvement Plan, PASS offers programming for youth and adults, essentially from cradle to grave. Much of our programming focuses around the youth because they're a captive audience. But more importantly, we know that equipping young people with the knowledge and tools to make healthy decisions can lead to a lifetime of health and prosperity. As Director Tammy Cologne mentioned, our community continues to confront the issues of resurging opioid problem. PASS supports our community by offering evidence-based substance use prevention programming, such as our Too Good for Drugs in the 3rd grade, Refuse, Remove, and Reasons in the middle school, and Class Action and Catch My Breath at the high school level. Our DBT Steps A program addresses social-emotional learning with skills on problem solving and emotional regulation. Both the DBT Steps A program and our Lifeline Suicide Prevention program offer students the ability to recognize early warning signs and help them identify trusted adults who can help them if they are in crisis. Our popular mental health first aid program is written to help laypersons recognize signs of a developing mental health issue, and it equips them with tangible skills should they be confronted with a crisis situation. We also offer Wellness and Senior Experience course for our seasoned residents to help them equip them with knowledge and skills to navigate later in life issues. PASS is a proud partner of our community support and CHIP process. I'd now like to turn it over to Jeff Ute from Lima Memorial Hospital.
Well, thank you, Rick. I am Jeff Utz from Lima Memorial Health System, and I would like to start by thanking you for the opportunity to talk for a few minutes today about a part of this year's plan that I am extremely excited about. That is the child wellness exams. No matter what you yourself call these, the American Academy of Pediatrics and the CDC agree that these visits are essential to the health and well-being of children. Why are they essential to children, you might ask? Well, wellness visits are a time for healthcare providers to thoroughly review and discuss the important areas of the child's development. Providers can complete a full physical exam, and they may even perform screening tests such as vision, hearing, and review labs on your child to ensure that they're progressing as they should be. These exams evaluate the physical, cognitive, emotional, and social development, and they use nationally recognized standards to provide and ensure that key milestones are met and can be addressed if there are identified concerns or delays. Providers will take the time to ask questions about specific family history. They'll discuss with you strategies for prevention of any identified concern or illness that may be in your family history. They will review medications, vaccinations, update them accordingly, and make changes as necessary. This wellness visit is also a great time to bring along any forms that your school may require or that are required for sports participation. The wellness exam encompasses all of those elements needed to complete these forms, and it also can prevent you from having to bring your child back for a separate visit in the future. During the planning process for this year's CHIP, we identified that Allen County has an opportunity to improve in this area. The baseline data gathered showed that 41.55% of children under 15 months of age have never had a wellness exam. From 3 to 6 years of age, only 23% of the children receive a wellness exam. This has even decreased further to 14% when adolescents 12 to 21 years of age. Quite simply, we need to do better. As I mentioned, one key element that is completed at a wellness exam is the review of medications and your child's compliance with these medications. We identified through this year's analysis that adherence for children 5 to 7 for asthma-related medications was at 73%. While this doesn't seem that alarming, really what it means is that 2.5 out of every 10 children diagnosed with asthma are not taking their medications as prescribed. Like wellness exams, compliance does seem to decrease as children get older. We need to ask ourselves, is this a direct correlation to the decrease in wellness visits? If these children had been seen, would there have been a discussion about their adherence challenges? Would they have found a solution to ensure that the child is protected from complications? In addition, we need to ask what other health indicators are impacted by this one measure. Could this have led to unnecessary emergency room visits? Is the child's ability to engage in physical activity impacted? These are the questions that we hope we can begin to start to learn the answers to. But it starts with the improvement of our child wellness exams. Our goal is to improve this measure by 5%, to see the percentage of children under 15 months of age receive a wellness exam, and we would like to see that percentage drop to 36.55%. We also have a goal to improve the asthma medication adherence. The goal, again, 5% improvement. We want to see those children ages 5 to 17 become more adherent with their medications. Our current situation with the COVID-19 pandemic will not make this an easy task in achieving. However, I will be the first to tell you the healthcare organizations here in this community continue to take the necessary steps to keep patients safe. We saw a sharp decline in childhood wellness exams and vaccinations early in the pandemic, but healthcare organizations responded by outreaching to patients in an attempt to get them back on track. The way that our care is delivered to patients has changed dramatically. Institutions quickly pivoted to providing telemedicine visits to sick patients. This was an effort to separate the sick from the well patients. Facilities have adopted more strict policies and procedures to ensure safety of patients. Pre-visit screenings prior to in-person visits, universal masking, visitor restrictions, and increased cleaning and sanitation of clinical spaces have been adopted. Healthcare providers and workers are prepared and ready to address concerns or answer questions for anyone that's apprehensive about an in-person visit. Thank you for your time today. And before I turn it over to Tyler Smith, I will share this quote from Socrates that I found very fitting for this goal. The secret to change is to focus all of our energy not on fighting the old, but on building the new. Next up, Tyler Smith, and thank you all very much.
Hi, I'm Tyler Smith with Mercy Health. I'm really excited to talk about a couple of the programs that Mercy Health has collaborated with Activate Allen County on to really impact the overall health and well-being of our community. The first one of those programs is our tobacco cessation program called Activate Change Quit. And this program is a program that was identified as a community need. Currently, there was 62% of smokers that had tried quitting within Allen County. 30% of those had earned less than an income of $25,000. And then demographic-wise, 30% of them were African Americans. And so we realized that this was a huge gap that we needed to address within our community. And so with this, we knew that this program would help identify and break down barriers and gaps for those that needed to get access to this care. And with this program, we had a community partnership that included Mercy Health, the Foundation, Activate Allen County, Ohio Northern University, and the West Ohio Food Bank. And the program was to bring together community partners to collaborate on a smoke and cessation program. And this program was funded through the Mercy Health Foundation, so it's a $100,000 grant through the foundation for a year-long program to address tobacco cessation. And the program is really a two-part hybrid. The first one is an outpatient model that is through St. Rita's Medical Management Center, and that is ran through our pharmacy, our respiratory therapist. We have behavioral health there as well. And that is a program that is comprised of group classes as well as phone support for 12 weeks. And the idea is that people come on there, they get the counseling and the education, and they go through the necessary steps to change their behavior, combat their desire to smoke and use tobacco. And through that, they each successfully completed session, they receive a nicotine patch through our outpatient pharmacy. And so that's the one model that we have. And obviously thinking about access, we needed to make something available too for the greater community. And so that's when our partners at Ohio Northern University and their HealthWise mobile clinic came in the mix. And so with them having the student pharmacists and partnering with West Ohio Food Bank, we had their mobile clinic that is parking there at the West Ohio Food Bank one time a week for 2 hours, offering free one-on-one sessions for the community, free of charge, and really going through the same counseling and education that St. Rita's is doing in-house. And so we're excited to bring this program. This program had launched in April of 2020. Obviously, COVID happened, so we had to put a little bit of that program on hold and kind of be creative on how we operationalize that moving forward. And so I'm happy to report so far that we've had a total of 52 referrals in-house with St. Rita's. 13 of those currently are active in the program. Of those that have completed the 12-week program, 80% of them have successfully quit smoking. And so and then 2 others have decreased tobacco usage by 75% after the 30-day mark. So this is a program that we're excited about and continue to build upon, as I think it's a need, and continue to identify other barriers for those within our community that may need access to quit smoking but are unable to do so. The other program that we've collaborated with Activate Allen County on is our Green Prescription Program. And this is a newly launched program that I think will bring a lot of value and promise and continue to enhance our partnership with Activate as well as other community partners. And really this program is to address food insecurity, food access, as that is a continued a barrier that so often is overlooked as a social need and can correlate to other health factors that we see within our hospital or that escalate throughout our community. And so this is a partnership that through Activate Allen County, Mercy Health, West Ohio Food Bank, and our family medicine residents at the hospital. This is a program where our patients are coming into our family medicine resident clinic. They are going through their normal patient appointment, but they are screening them then for food insecurity. Using the Hunger Vital Sign questionnaire, which is a evidence-based questionnaire to identify positivity for being food insecure. And so they're currently doing that with our patients. The program then will, for those patients that identify as being food insecure, partnering with the Westside Food Bank, they are able to offer 2 different sets of emergency or shelf-stable food boxes there at the clinic, one for diabetic patients as one that's heart healthy. And so if someone comes to the clinic and they are positive for being food insecure, they will get one of those emergency boxes that will last, depending on the size of their family, up to 2 weeks. And then we are connecting them with our care coordinators who are making sure that they are following up and seeing if there's additional social needs that are maybe not being met that we can link with them within the hospital, and then also creating those linkages to other community partners in that safety net within our community to address that. And so they will come on, they can come and get a food box at the clinic every 2 weeks just for the resident and our physicians to better gauge their overall health. At the 8-week point, they will come back on for their appointment, their follow-up appointment, where our physician residents will do their vital sign, their biometrics to see if any of their lab data, if any of their health outcomes have improved with the ability to have access to healthy, quality food. And so we're really interested in this because we know that among the many social determinants, this may have a factor within their mental health. So does their mental health improve? Does their ability to, have an economic stability and just better manage their overall health and long-term outcomes? So we're very excited about these 2 programs in general. We're continuing to build these pilot programs and make sure that we have the necessary resources for these to have even a greater impact and value within this community. And now I'd like to introduce Dr. John Snyder.
Thanks, Tyler. We appreciate everything you're doing to improve the health of our community. I'm John Snyder, and I teach at Ohio State Lima. Did you know that about 80% of what contributes to our health are 3 things? Behavioral factors, that's the decisions we make. Social determinants like transportation and access to healthy foods, and the environment, a safe place to exercise. For that reason, at Activate Allen County, we believe everyone should have access to healthy foods and the opportunity for physical activity. As a community health coalition, it's our mission to influence and improve the culture of health and well-being for the residents of our county and region. What you just heard is just a small sample of what can happen when a community works together. Instead of small pockets of efforts to improve our health, Activate brings these efforts together for collective impact, leading to a larger outcome. We're helping to improve health and well-being. For example, the Business Challenge. We're working with employees of businesses. With the School Challenge, our youth physical activity while still learning and dealing with mental health issues. And our Neighborhood Challenge, creating healthy opportunities for families. Because the health of our community affects everyone, there is a role for everyone in our efforts. Truly, all of us are Activate Allen County, and we invite your engagement and participation. Our vision for the future is a community, a vibrant environment where health, safety, and overall wellness are the priority, and where shared values produce the ideal place to visit, to live, to learn, to work, to worship, and to play. This for all. The efforts of Activate are coordinated by an executive council. It's now my pleasure to introduce the chair of our council, Amy Markham, from Mercy Health, our anchor institution.
Thank you, Dr. Snyder. Hello, everyone. I'm Amy Markham, and I am the Chief Mission Officer for Mercy Health here in Lima, and I have been on the Executive Council of Activate Allen County for the past 5 years, and I am the current chair of the council. I've been involved with several community health improvement initiatives in the county and have been inspired by the dedication, passion of so many in our community seeking to improve health and well-being for all. You have just heard from some of them, and know there are many others doing this good work. I believe our county is blessed to have a coalition such as Activate Allen County that brings key agencies and organizations together to address the complex issues that deter individuals from living healthy and meaningful lives. It has been noted from others doing similar work in other counties across the state and nation that it is quite unique and is a best practice to have such a strong coalition in our county, creating safe and healthy environments. As noted earlier, chronic illness, maternal and infant health, addiction, behavioral health, and social determinants are needs that have multifaceted causes and effects. Though we have made progress, we still have a long way to go. I truly believe our community can and will come together to make even more progress. I believe we are all called to use our gifts, skills, and resources and efforts to work towards a common good. To do this, we have a responsibility to address disparities, help those most in need, and create policies, places, and communities that create optimal, healthy environments for all. On the screen, you see the active contributors to Activate Allen County. As you all know, passion is important for all these initiatives. Also, financial backing is needed. Today, we are asking you, your organization, to join all of us in becoming a stakeholder. At Mercy Health, our mission is to improve the health and well-being of our communities, and with a special attention to the poor and underserved. We are dedicated to this mission every day and acknowledge we are only a part of the solution. It takes all of us, schools, businesses, the city, county entities, those partners serving in health-related services, profits, nonprofits, churches, individuals, service groups, all of us. That is why we, Mercy Health, are a key supporter of Activate. Because of the collaborative nature and actual and potential impact, on behalf of the Executive Council of Activate, I am asking you to consider joining our efforts through an initiative and/or by providing a donation to Activate Allen County through the Chamber Foundation, which is a 501c3. As we continue to expand our resources and support, we plan to continue messaging to the community and increasing the projects and impacts of our efforts. Please reach out to Kayla or Josh if you would like to learn more or to discuss this possibility. Thank you for your time today. Let's continue to work together and seek solutions and opportunities to make Allen County and the surrounding region a vibrant environment where health, safety, and overall wellness are the priority, and where the region's shared values have produced the ideal place to visit, live, learn, work, worship, and play for all. I will now pass this over to Josh for some closing remarks. Thank you.
Once again, thank you for joining us for our virtual State of Health in Allen County event. And I also want to thank the many people, organizations, and businesses that are dedicated to making Allen County a better place to live, work, worship, and play. If you have any questions about our collective work or would like to get involved, please contact us with the information that is on the screen. Together, we can accomplish anything. So once again, thank you for your time. Be safe and take care.